the population policy has been divided into 6 main thematic areas that we looked at broadly. And we have population size, growth, and age structure. That is the first population, the first thematic area. Then we have fertility. Then the third one, we have morbidity and mortality. Then the fourth one, we have mobility, migration, and urbanization. We are looking at issues to do with migration, and we are asking whether Baringo County is a receiving or a sending away county, and that is actually the process that is ongoing in the group work that the participants have started. The fifth thematic area is on population, human settlement, environment, and disaster, and we are looking at the environment issues that are affecting Baringo County. And I want to state that in each and every thematic area, we have highlighted the policy issues that are there, the concerns that are there, and then we also give a brief of maybe the population measures.
For Baringo County, the population is growing. It's well above 660 people, up above the previous census, and the growth rate is at 3.3, higher than the national at 2.2. That means this population can triple within a very short period of time. If you look at the key indicators that we demographers look at to see how the situation of population is, like the average number of children women are having, what we call the total fertility rate, is higher than the national at 4.4. If you look at the teenage pregnancy again, it's higher than national at 21.3, which is at 20.3 rather, which is, and Baringo is among the top 10 leading in teenage pregnancies, which is not a good situation. If you look at child mortality again, we are not okay in Baringo. It's high at 55 per 1,000, higher than the national one that is 41 per 1,000. So really these issues, they need to be discussed. Other issues are around sanitation, water for drinking. Most of the people here are getting water from the surface that is really affecting the well-being in terms of the health, mortalities, and morbidity. The issue of using toilets that are improved so that they dispose of waste is also very low in Baringo.
What contributes to such a scenario that the places that are deemed to be a bit difficult or hardships tend to have such a high population? What could be the factor that tend to have such a number going up?
Population growth rate, if you look at one thing is about education. Right. When these girls get married early, you see we are talking about teenage pregnancies. So if this girl is married, say at 10 years, by the time she lives through her reproductive age, how many children will she be having? Very many myth and misconception about family planning. You know, there are told many myths that need to be demystified. The issue of poverty, the issue of male are not really being involved in decision making. You know, this is a patriarchal society, and when men decide that you must have 10 children, you know, women have no say. We talk of equitable distribution of resources. Yes. So the idea that one man, one shilling, I know that's where you're headed.
Yes. Yes.
Us as demographers,
it speaks much about the same.
That one is a bit misguided.
Yes.
And we are reaching out to our policymakers so that they understand this. Not every the same size cannot fit all, even at household level. What a requirement of a father of the household is not the same as at the kid. So we are talking of equity in terms of even resource distribution, so that you don't make our women panic. Even our politicians, they panic telling the women to give birth. Wafanye nini wapate pesa mingi. And even those counties where the revenue goes a lot, it's not used for development. It's used for recurrent expenditure. That linkage bit of it is not well understood. Yeah, so let them not really. If a woman is having almost 5 children, you know, when you tell her to give birth to many children, again we are her life again. She's likely to suffer from maternal what? Maternal death. GM is still high in Baringo also, and we really, it's a concern because it has a direct implication on the well-being of these women. These women who have been circumcised, some of them die, they bleed to death. Some of them, when during childbirth, they get a lot of complication, and it has a bearing to what you call maternal death among